I suppose when research was paused in March, we were not sure what would happen. Nobody was within the next few months. But what actually happened is we were notified, the Research Institute was notified of a number of urgent public health projects relating to COVID-19, most of which we reviewed and approved depending on the patient population we thought we might have.
We know that in the very sickest of patients with COVID-19, those that end up in intensive care and ventilators, that the COVID disease begins to have an effect on their entire system. And one of the organs particularly that we think is affected is the heart, and specifically the right-hand side of the heart, the side of the heart that pumps the blood to the lungs. And we've got expertise in studying the right heart here in the Golden Jubilee in other groups of patients. So in this study, what we're trying to do is apply what we know about the right heart and look for that right heart problem within the sick patients in intensive care with COVID-19. In the study, what we're trying to understand then is whether COVID-19 has an effect on the heart at all, and we're doing that by using ultrasound scans of the heart and blood samples, measuring markers of heart injury in the blood. And if we find that heart problems, what we're interested in is the mechanism of what causes it, with thinking about how we can prevent it in the future, and also looking to study what impact it has on outcome. So we strongly believe that heart problems could be part of what influences patient survival in intensive care with COVID-19, and of course important to understand that so we can treat it and prevent it for the future. So this is a specialised ultrasound scan of the heart known as a strain echo, and the heart chamber there that's highlighted in colour is the right ventricle, the right hand side of the heart that's pumping the blood to the lungs. And this is the area of the heart that we believe is affected by COVID-19 in patients on ventilators.
A lot of the work that we did at the Jubilee, specifically carried out by my colleague Vicky Daybeck, was to coordinate the 12 sites, and that involves from the start making sure that each one has an agreement, has all the documents in place, and has everything they need to carry out the study. Each site was given a recruitment target of between 12 and 15. But we have a lead research nurse for the COVID-19 project, which is Val Irvin, and Val gives the nursing, slant on the project in the same way that Vicky gives admin support for it. So Val Irvin will support the nurses in the other sites and the work related to COVID-RV. The work of the Institute is ongoing, and we're looking forward to, in the next few months, returning to some semblance of normality. We will have all of our portfolio projects open and all of our staff fully engaged in those projects.
So this study is running in 12 intensive care units throughout Scotland, and we've been humbled by the hard work that's been going in all centres. The buy-in we've had, these people working in the hardest of conditions with no dedicated time for research, who are studying this because they know it's a problem and they believe in it, and we were very grateful for the input we're getting.